Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Switching topics to breast implants, Motiva implants are probably going to be coming out in early 2024. So if you look at their last clinical submission, and like approximately 10 months later, most things get approved by the FDA. And of course, nobody really knows. But we're talking like for probably in the first 6 months, Q1, Q2 of this year. Establishment Labs, company that's publicly traded based in Costa Rica. Their main product is Motiva breast implants, already in Europe and South America and Asia. They're coming to the US. So are you excited? You're holding off? You're just thinking about it?
I like to keep my finger on the pulse of things and then hear what you think.
Oh, so for the consumers out there, we have today smooth shell implants. So it's an envelope and it's smooth. And what happens is that it's very good technology. It's very old. It's very known. There are a couple problems with smooth shell implants. There's still some tissue reaction. They could rotate. And the way the biophysics is of the envelope, sometimes it's not quite as soft as it could be. Sometimes there's some debate, but they think certain manufacturers have thinner implants that have a higher problem rate, whereas other manufacturers have a thicker implant. They have a lesser problem rate, but it doesn't feel as nice. It doesn't feel as natural. With Motiva, it's very interesting physics because technically it's a smooth implant. But if you look at it, it's like, come on, dude, this is not smooth. This has like some slightly pebbly surface on it. It feels like velvet when you touch it. Technically, though, according to biophysics, that's a smooth textured implant. And because of the way that it works in the human body, there's not much tissue reaction to it. So specifically, there's not much capsule.
So this is interesting, right? Because it's a very popular implant outside of the United States.
Huge.
And why do you think that is? Is it surgeon driven or is it patient driven?
It's
or
everything.
both?
So in terms of pure science, I know some of my friends overseas really love it. They have warned me or told me, look, when you use it, you have to have a smaller pocket, a more precise pocket. You're not going to have as much capsule, which is great for the patient. You're not going to have as much tissue reaction, but like if the pocket's normal size or a little too big, the implant may drop. It's just not going to form as much scar tissue around it. So you have to be very precise in terms of the pocket creation as well as closing it. The other thing is that I think they do fantastic marketing. I mean, they even have an Instagram account here, and it's extremely business to consumer friendly. And it's my friends in Korea, my friends in South America have told me it's the only implant that patients ask for by name. They don't know Allergan. They don't know Mentor. They don't know Sientra. They don't know PIP. They don't know anything. They don't know Sebin. They don't know these other big companies. They know Motiva.
Well, that is huge. And that to have patients ask for anything by name, whether it's a breast implant, whether it's a neuromodulator, a filler, that is really significant. Because I think in most of those cases, the patients are coming in for the procedure or the result, but don't necessarily have an opinion on the material being used.
Yeah. We don't ask for facial tissue paper. We ask for Kleenex. Patients don't ask for neuromodulator. They ask for Botox. And Allergan's done a fantastic job in terms of marketing of making sure everybody asks for Botox because it's their name. Well, Motiva has done a fantastic job overseas where patients ask for Motiva. They don't ask for breast implants. So
are you going to be an early adopter?
I think so. As soon as it comes out, I am eager to try it because the other thing is that it's a publicly traded company. I mean, so technically they have a lot of money, specifically a lot of reserves. The warranty means something. They are already currently under U.S. at least like accounting regulation because it's publicly traded. So they have also a lot of sales overseas. So this is their final frontier.
I know where you're going with that last comment. Are you drawing a comparison?
Possibly, because, Mentor implants are owned by Johnson & Johnson, the world's largest healthcare company. Allergan implants, natural, are made by Allergan, part of AbbVie. AbbVie is a massive, massive company. Sientra is a tiny company. They have FDA-approved implants. Their implants are fine, but I just question, how long they're going to be around. If they go under or go into receivership or whatever, what's the lifetime or 20-year or 10-year warranty mean in a Sientra implant? I don't know.
And I think that's a concern for a lot of people because they have the best warranty on the market as of right now with 20 years. But it is a concern. What does the 20-year warranty mean if the company's not around in 20 years? And I agree with you. I think most surgeons feel like it's a great product and a great device. And I've done some consulting for them. And so I've seen a number of patients across the United States who've had their implants in for 10 years. And the overwhelming majority of them, this is all different surgeons, so kind of controlled in that sense, they're really happy and the patients look great. But it's one reason I don't use Sientra in my own practice, because I don't know that they're going to have the level of service with them in 5, 10, 20 years.
Yeah.
So we'll see.
We'll see.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.